Hello, good morning, good afternoon, and good evening for some of you. Welcome to this session. People keep coming in. I just wanted to welcome the people which are already connected, and to inform you that this session is recorded as you join in. I will also kindly ask you if you can write your name, title, organization, and country in the chat box as a way to introduce yourself to the other. So welcome to all of you to this webinar, which is co-hosted by the Global Nutrition Cluster and the Sun Movement Secretariat. So I'm Catherine Chazali. I'm an independent expert working in the field of nutrition for more than 20 years. I'm really delighted to be part of this project, a rather challenging project, looking at the humanitarian development nexus for nutrition. I had the opportunity to conduct the 3 case studies that are going to be presented to you today. So case studies which were conducted on Myanmar, Niger, and Afghanistan. Today also we will hear directly from a practitioner from Afghanistan, Mrs. A. Kane, who is a nutrition cluster coordinator in Afghanistan, and who will share her experience of the nexus for nutrition in Afghanistan. And of course, during all this webinar, you will be able to ask a question in the chat box, and this question will be shared with the speakers at the end of the presentation. So maybe to start with, if you are ready, I would like to invite Stephen Williams from the Sun Secretariat, as well as Anna Ziolkowska from the Global Nutrition Cluster to introduce this webinar by sharing their vision of the humanitarian development nexus and how they engage in this great adventure. So Steve, if you want to start.
Yes, I hope everybody can hear me clearly. Good morning, good afternoon, good evening. I welcome you all. It's good to see so many representatives from so many different countries and so many different stakeholder groups. I welcome you. My name is Stephen Williams, and I work for the Scaling Up Nutrition Movement Secretariat based in Geneva. I just wanted to say a few words to frame this study and the nexus in general within the Sun movement. So what does the nexus mean for Sun? As you all know, the Sun movement was created to help all sectors and stakeholders that directly or indirectly impact nutrition to work better together. The aim was and is to break down the silos that inhibit sectors and stakeholders from effectively aligning their programs to better tackle malnutrition in all its forms. The Sun movement is celebrating 10 years of relentless efforts to ensure a government-led, multi-sector and multi-stakeholder approach to malnutrition. In 10 years, Sun has been relatively successful in setting up in-country multi-stakeholder and multi-stakeholder coordination processes. These are typically facilitated by a government focal point and supported by civil society networks, donor networks, UN agencies, and the private sector. We often call the resulting system a multi-stakeholder platform, but they often go by different names in different countries. Breaking silos and aligning programs around commonly agreed to objectives is challenging and is a process that takes time. And it is maybe for this reason that initial efforts primarily focused on government and development stakeholders. However, full inclusivity is the key to success. And as it is often quoted, that to tackle malnutrition, you need all of the services, all of the time, and for all of the people. As being holistic and inclusive is key, we will clearly not succeed in what we do if we do not ensure that humanitarian stakeholders and their coordination systems are as integrated into the multi-stakeholder platforms as each specific country context allows for. The respect for and inclusion of the humanitarian nutrition partners in the multi-stakeholder platforms is what the nexus is for the Sun movement. So why now? Well, it's not really now anyway. There's been a lot of work done over the last 10 years, with the last big effort coming in 2017 when Purnima Kashyap helped the GNC and Sun movement to enhance the nexus. And we produced 2 guidance notes for resident coordinators and humanitarian coordinators at the time. It's also true that after 10 years of work, we have managed to strengthen and to better understand the benefits of the multi-stakeholder approach. And this creates a much more conducive environment for the additional challenge of making sure that we do have a humanitarian development nexus as well in place. And finally, there is no escaping the impact of the COVID-19 pandemic. Yesterday, OCHA released the Humanitarian Needs Overview for 2021, and the projected surge in COVID-induced needs is staggering. We can only hope to tackle and overcome this if we all work together in an aligned manner, respecting and making the most of our respective knowledge, competencies, and resources. So what next? Well, I'll wait until the end of this webinar to say a few additional words on that. The nexus means a lot of different things for a lot of different people. So please do listen with an open mind, and please prepare any questions you have and put them in the chat box, or ask to take the floor during the Q&A session. We want to hear from you. Thanks for listening, and now I pass you back to Catherine.
Hi, everybody, and oh, sorry, Catherine. So this is Anna. I'm the Deputy Global Nutrition Cluster Coordinator, and sorry, my camera seems to be not working. I'm not sure why. So I just wanted to fully agree to everything what Stephen told, and I thought that instead of repeating, I will just share an example what Nexus means to me. So before, when I was working in the country, there was a lot of discussion on humanitarian development nexus, but personally, I felt that there is no clarity. For me, I kind of understood what it was, and others people, I think, kind of understood as well. But then if we talk, it's a little bit different understanding. And nobody can actually put on paper and say, this is exactly what nexus, and then everybody agrees. And then when I started working at global level, I thought, personally for me, I thought that it's very similar discussion, and we don't have a clear way of this is what we are going to do and this is how we are going to do. But what was good is that we already knew that because we are working in nutrition, for us as clusters or as sectors, emergency work, we have Sun who is a counterpart, and at least we were able to know with whom we need to talk about that. And I still remember we had these discussions with the Sun, and we came together and we said, yes, we need to work on it. We need to work together. We need to advise countries on what to do, but then we didn't know how. So we kept this conversation, and then we developed the terms of reference and the plan on what exactly needs to be done, so it becomes clearer. And it was a joint project where we developed it together. And then we went fundraising for this because none of us had money, and then the GNC got money first. So we are responsible now for these projects to the donors, but we are working together with Stephen and with the Sun Movement Secretariat on this project. For example, we were hiring a consultant to do this work together. We did all the interviews together, shortlisting together, we are reviewing all the documents together. I constantly call Steve saying, look, I don't know what to do here, how we are going to do that, what is your advice? Before making any decision, I talked to him and I said, look, this is what I think we need to do about this project. What do you think? And for me, that's nexus. For me, this is just being able to call your counterpart and having this discussion, maybe having one joint projects together, maybe having a plan together, maybe fundraising together. Maybe just having a meeting and say, oh, I think that my counterpart development of humanitarian should attend that meeting. If we all already start doing that I think we are well on the way to actually implement a humanitarian development nexus. And Catherine will talk more about the recommendations, but the main learning which I had from working with Stephen on this project is that it's not that difficult. You just need to have people willing to talk and to communicate. And with that, I'm handing over to Catherine for the details.
Yes, thank you very much, Steve and Anna, for this introduction. Sorry, it seems that there is maybe some kind of setting issue with the video, but well, here we are. So yes, as Steve was mentioning, if you have any questions during the presentation, including with the discussion we will have with A later on, just put your question as they come in the chat box, and also please share your name, title, organization, country, as well as your email, so we can send you further information. So I will introduce you shortly to the main lesson learned from these case studies, which I conducted with Myanmar, Niger, and Afghanistan. A policy brief has been recently published, and it will be shared on the website, and also it will be shared with you to provide you with more information. Okay. Okay. So just very quickly, so these 3 case studies were conducted with a very specific objective to look at how actors are collaborating around the nexus in the sector of nutrition. So it's really focused on this collaborative aspect. And also trying to understand how the nutrition cluster or nutrition sector coordination group and the Sun multi-stakeholder platform could support these processes. It was mostly based on existing information, secondary information, but also on a set of interviews and consultation with key stakeholders. All these consultations were done remotely, unfortunately, due to the current pandemic and its constraints. And it was done between August and September. So this is the policy brief I was mentioning. So it has just been published, and it will be shared with you shortly, summarizing the main findings and recommendations from these case studies. So what I found out during these case studies, in terms of the very positive point, there is a strong political commitment for nutrition, more and more in all the countries which were studied. There is also policies, strategies, and coordination mechanisms which are in place. There is also an important collocation of humanitarian and development actors in the priority areas and in the public health system. So humanitarian and development actors are very much working side by side in some specific geographical areas and through the health system. And there is an increasing flexibility also of the financing instruments, offering more opportunity for humanitarian and development programs to work together. However, what I found out also during these case studies is that actors still have a very different understanding of what the humanitarian development nexus is, and what could be its benefits, and also what could be the area of convergence that could be found between the humanitarian and development actors. There is also a definitive lack of investment in nutrition and in disaster preparedness, which is also making programming and convergence more difficult. The commitments and plan, especially the multi-sectoral plan of action for nutrition, are still not implemented at scale as the consequences of this lack of investment. And some organizations have more difficulties than others to participate in all this process due to their lack of resources, lack of human resources, time availability. So there is a kind of different level of participation depending on the organization. So really, so we developed a kind of set of 5 main recommendations based on this observation. So the first one is really to kind of develop a common understanding of the humanitarian development nexus among all stakeholders as a kind of starting point to be able to work together. So the recommendation is really to kind of conduct to continue, because it has been already a lot of work done on increasing the awareness around the nexus and how it can contribute to improve nutrition in the different countries. But the recommendation is really to continue this process and maybe to increase, you know, the number of information and training sessions which could be done on the nexus, to disseminate the materials which are already existing. As Anna and Steve were saying, there is already a lot of things which have been done, and to foster even more exchange of experience. And going back to this observation regarding the need for more inclusion, to really also include the subnational level into this session. They are very important actors in the field of nutrition, so they need to be more included. The second thing is again to foster this improved collaboration. Is really to look at priorities. What could be the common objective? What could be the common priorities that humanitarian and development actors could share? I think it's for the nexus to start or to continue to develop. The actors need some clarity on where to start and need to be a bit more kind of concrete element to be able to start this collaboration. So it seems very important, you know, that all actors are clear on what could be their common objective and priority that they will follow together. And then it needs to be prioritized, because of course there is not enough resources to do everything. So you need to start, you know, on some kind of very specific, concrete action and objective. And then this also could contribute to facilitate the development of aligned action plan, monitoring, implementation strategy. So it's really about kind of establishing common ground to build this next. Then another things which came out also of the case studies, there is a lot of coordination mechanism, meetings. However, sometimes there is not enough space, or there is not a space for the humanitarian and development actors to meet on a regular basis. Doesn't need to be additional meeting, but just maybe that some of the regular coordination meeting taking place to ensure that both humanitarian and development actors are invited and are participating into this session in a regular basis. And then, as I was mentioning, there is this issue of inclusion. Not all actors have sufficient resources to participate in all these processes. Sometimes they have only sufficient resources to implement programs, but not to get extra time to participate in these processes. So there is a need to support advocacy to mobilize additional resources, so all actors could really participate in the coordination, in identifying this common objective, implementing them as well. And then one of the important things also to support the nexus is to continue with the promotion of intersectoral coordination, which could be improved in some countries. Then one of the opportunity which were identified during these case studies for humanitarian and development actors to work together is to support the implementation of the national multi-sectoral plan of action. These plans are in place in the different countries, but they are not implemented yet at scale. And definitely, there is a space for humanitarian actors as well as local actors to really support the implementation of this multi-sectoral plan of action. First of all, by sharing the evidence on nutrition needs, on causal analysis, on risk that they can collect through their work. The same also sharing all the lesson learned, which is done on programming and especially on preparedness and early response to crisis, which is also an area where more collaboration between humanitarian and development actors could really bring very strong gain and benefits. Also to advocate for greater alignment on development and humanitarian funding. As I was saying, there is an increasing flexibility of the funding, but more could be done on this to really strengthen this collaboration and the transition and the nexus between humanitarian and development actors. And really also humanitarian and local actors could really support the prioritization of this plan. They're often very ambitious, very wide, and because of this limited investment into nutrition, some prioritization need to be done. And then finally, really looking at the issue around inclusion, strengthening participation of the different actors. What came out of the case studies is really that people would like to see more accountability to results. So there is a need, of course, for all actors to respect and understand the specificity of the humanitarian actor. As well as to understand and respect the specificities of the development and government actors, but also people would like really to see more accountability. So it will be important really to ensure that the commitments towards annual budget tracking are fulfilled, that there is also regular reporting, and this will really contribute to increase the participation and trust of the different actors into all this process, as well as getting really clarity on the role and responsibilities of the different actors into the different committee groups, coordination mechanism that could be created or that are already ongoing and which could support these processes. So this is in a very, in a nutshell, you know, the kind of main findings and recommendations which are more developed in the policy brief. And maybe to give you a bit more, let's say, concrete information, concrete input, I would like to ask AA Kane to join us in this discussion. So So AA is, let me start the video. Yes. So AA is a nutrition cluster coordinator in Afghanistan since February 2020. Before that, AA has been supported integrated nutrition programs, especially in Myanmar and in the PRK. So welcome, AA.
Thank you, Catherine. And I'm looking forward to the discussion.
Yeah, thank you very much for joining us and for accepting to present the experience of Afghanistan to other countries. So to start with, could you kindly tell us what the humanitarian development nexus is enabling to do for nutrition in Afghanistan? What is the kind of added value, additional gains that could be seen in Afghanistan through the humanitarian development nexus?
Thank you, Catherine. as Stephen pointed out early on, humanitarian development nexus, or the Anna from Global Cluster pointed out, the humanitarian development nexus for nutrition could mean different way for different people. For Afghanistan, at least for Afghanistan nutrition cluster, humanitarian development nexus mean that we want to make sure that whatever we do to improve nutrition is sustainable. And therefore, by joining in this study, it allows us to raise profile of nutrition in general in the country. And that is the added value this study brought, and this the follow-on linkage with AFSAN brought into Afghanistan. And certainly humanitarian partners, we cannot implement humanitarian nutrition actions, same actions over and over again. We do need to link with development partners to raise the profile of nutrition in the country. And also the added value the humanitarian development nexus in nutrition in Afghanistan bring is that from a nutrition cluster perspective, yes, there are overlap in memberships between AFSAN and Afghanistan Sun Alliance and nutrition cluster, but there are also members that are not part of nutrition cluster, but that can add value in raising the profile of nutrition, especially the business community, academia, and other national organizations and civil society alliances working in nutrition. And that if we are talking about humanitarian development nexus in nutrition in Afghanistan, we need to join these forces together to raise the profile of nutrition in Afghanistan. Over to you.
So when we conducted this case study, I had the opportunity to discuss with you and also with Dr. Shams, which is your counterpart in the AFSAN agenda, and who is going to speak in the webinar tomorrow. And really we discuss, you know, very concrete example of where humanitarian and development actors could collaborate. For example, I think, for example, you work a lot on the transition between humanitarian intervention and the strengthening of the system around the health center. I don't know if you can provide some kind of example, you know, of where you see really humanitarian and development actors working together and going, you know, a step forward.
Thank you. The Afghanistan health system is interesting. Ministry of Health, they don't necessarily own the entire workforce, health and nutrition workforce. They are more like a franchised business model where certain numbers of NGOs are considered as development partners, and humanitarian partners fill the gaps that development partners cannot meet. But then again, the humanitarian partners alone, they cannot meet everything. The example is the nutrition around adolescents and setting up systematic social safety net program, scaling up that kind of social assistance program in the country. There, we humanitarian partners alone cannot do everything. We are mandated to fill the critical gaps, critical nutrition gaps in the country. But we also see the huge needs not being addressed, where we think we can collaborate and strengthen that aspect in the country. And in fact, that will also be part of the next year humanitarian response plan, where we would need to join forces with development partners to cover areas that are not necessarily addressed, needs that are not necessarily addressed by the humanitarian partners.
So, could you maybe also give us some other example of what more could be done in Afghanistan, especially if humanitarian and development actors are working together? What could be the kind of additional gain? You mentioned the system strengthening. You mentioned working on some particular topic. What do you think can be do
of
can be
course,
done, you know, through this nexus?
Stephen also mentioned it in his opening remarks. We also need to integrate humanitarian coordination mechanism into multi-stakeholder platform, and that is that is something we need to do next year as well. And of course, in terms of what more we can do, we also need to be realistic given the country situation. And that's one area I see, one big stepping stone I see that we have to do in the immediate coming months, where humanitarian coordination, nutrition cluster coordination mechanism should be integrated into multi-stakeholder platform.
And from your point of view, so you have not been in Afghanistan for a long time, but you hear what the other actors are saying, and you have been working also in other countries. So from your point of view, what are the kind of main challenge, but also opportunities? What are the lessons learned, you know, of the past month, your past month's experience in Afghanistan, about, you know, building this nexus?
Yeah.
What?
I don't claim that I know everything in terms of humanitarian development nexus in Afghanistan, given that I started my role in February. But from talking with different partners and from being part of this study, I have came to, or nutrition cluster partners came to realize that we cannot do our nutrition work in silos for sure. And we always talk about sustainability of humanitarian actions from nutrition cluster partners. But we have to be realistic given the Afghanistan context. A lot of the humanitarian program actions are short-term with really short time frame project cycle. But we are able to fill the critical gaps. But when it comes to sustainability, that's something we can really work with development partners.
So then, so you told me before this meeting that you're already starting to implement, you know, some of the recommendations which came out of the case studies. Could you maybe share with the participants what are the upcoming activities, you know, that you are planning to put in place and to conduct with Dr. Shams to move this agenda forward?
The most doable and most practical first step is start the communication and interaction with AFSEN and its members, and that is the first step we plan to do. And we, as a cluster, we are aiming to have that this month, but we will see how it goes. If not, it will be in coming next 1 or 2 months that we will start having a joint coordination meetings around nutrition. So that's the first big step that need to happen, as I feel as a cluster coordinator. Then reaching out to big players like World Bank for covering the gaps that are not covered under humanitarian framework or cluster. So that's the second step. And the other one is with the advocacy around investment in nutrition. You know, I always hear let's improve nutrition with low cost, with low cost that will reach more people. For example, people think behavior change social communication is low cost and can reach many people. It is right to a certain extent, but in terms of really seeing the substantial change in behavior, it requires a lot of resources to change feeding practices, to change the system, to change the norms around nutrition. So that also need to be advocated strongly in Afghanistan, and that's where I think development partners and AFSEN can help. And over to you. I'll pause a little bit.
No, I think it's really a moment for you, to share with, I don't know if you have additional points you would like to share, or if not, maybe we can open the floor to the question of the participants. What do you prefer?
Let us hear from other colleagues in the room.
Okay, so we are not many. I do not see a question in the chat box. And we are not many. So maybe if you just want to raise your hand and open your mic and to ask your question to A or to Steve and Anna, or even myself if you need any clarification.
Hello, Kathy.
Yes, please go ahead.
Yes, this is Admire from Zimbabwe, but I would like to just comment on Afghanistan. I was previously in Afghanistan for about 3 years until April last year, together with Antenna. I think he's there in the background. So maybe we can also comment on the efforts that we've seen of trying to link the humanitarian and development nexus. One of the issues that we really struggled with was the issue to do with information systems. I don't know how far you've moved with it. You have the routine information systems that are collecting data, and it is from these routine information systems where you want to have early warning, which gives you an indication to say you are getting into the danger zone and you need to start thinking of response as a humanitarian action. So I think the health information system was one such platform where there's a disease early warning system, which collects even information on. We try to integrate nutrition information into that system so that the humanitarian workers, humanitarian team can make use of the data when it gets into red flags. There's other platforms like the health development platforms where issues to do with development and emergence were also discussed, where you discuss the issue of coverage of health services, the issue to do with gaps, and the issues to do with the analysis in the Afghanistan context to say at what point do you say you have reached a humanitarian status, what level of health service delivery that cannot withstand the normal work caseload would you say requires the humanitarian actors to come into play. So I think that was another platform that was being used to sort of bring the humanitarian and development nexus together. So I thought I should add this because I've been part of the Afghanistan team with Shams just before just to help on that aspect. Over to you, Kathy.
Thank you, Admire. Maybe you can provide a kind of an update and also maybe link this with very concretely to the nexus.
Yes, we do use this, what we call a National Nutrition Database platform, and it's a platform where all partners are requested to report their achievement, and we also have access to, we also get coverage information from that database. And I must say that that database, from what I gathered with UNICEF Nutrition Cluster Information Management team, it has improved substantially. And we do make use of that platform. And certainly, that is the platform that help nutrition cluster inform humanitarian response plan. And of course, this response plan is communicated to humanitarian country team, where other actors, including donors and actors like World Bank, sit in. So certainly from that nexus perspective, we contribute with the analysis by using these platforms.
Thank you. Is there, for this very concrete example of collaboration, is there any other questions from the participants? So maybe I will leave you a bit of time to think about it. I have a few last kind of conclusion or ideas that I would like to share with you, coming from the case studies and from all the work which is being done by the Global Nutrition Cluster and the Sun Secretariat on the Nexus. So these are a few suggestions we would like to share with you, and maybe after you can also react and tell us if it's realistic or not to look at this. So what we would like you to do, so you shared with us your email, and we will be sharing the policy brief with you. It's going also to be available on the website, as well as the recording of this particular webinar, in case you want to share it with colleagues. So we would really like you to look at the policy brief and the recommendation, and to organize a meeting with your colleagues from the Sun focal points, Sun multi-stakeholder platforms, cluster or sector coordination groups, and to discuss this recommendation. So we would like to ask you personally to look at this recommendation and to reflect on it, and as much as possible also to involve the SAG and representative from the different coordination groups and some movement in your country, to look at this recommendation, look at are they applicable in your country? Maybe some of them have been already implemented in your country, but maybe some are not. And to look at what could be the priorities for you. And after this meeting, we would like to ask you, to engage you to contact the Global Nutrition Cluster and the Sun Movement Secretariat with very kind of concrete proposal from you in terms of what you would like to do, what will be the next step. As I was mentioning, in Afghanistan, they already have a plan for the next step. So to contact the Global Nutrition Cluster and the Sun Movement with what could be your priority, and also which type of support your country might be needed in order to implement this very concrete step. So on this screen, you see the email of the people who will be able to answer to your questions. So Bryony in the GNC and Steve in the Sun Movement Secretariat, and of course this will be shared with you after this meeting. So I don't know also if you would like to react to this.
Maybe Catherine, while we wait for people to take that in and to formulate some questions, maybe I can just add a few points as well, as I said towards the end. I think that as Anna mentioned and a few others, is that in theory, whether it's the multi-sector and multi-stakeholder approach or even the nexus, the theory is very simple. We all understand it. But we also know that in reality, it can be very complicated. We have to manage a lot of different moving parts. with different people coming from different places, different mandates, different approaches, different principles, and that can be very challenging and very time consuming. On top of that, I think that if ever the saying there is no one size fits all fits somewhere, it is for the nexus. I think in every country context there will be a need for a completely unique approach. There'll be different challenges and different opportunities that are worth pursuing for a starting point. It's also clear that I think that everybody on this call and everybody working in a crisis affected area is already engaged in the nexus. It's not as though we're bringing something new to the table, as said before. A lot of work has been done and you are all doing a lot of work already in the country. Even if it's just participating in this webinar, that's already a first engagement in a dialogue, if that's only at the very start of the process. What we're trying to say is that the Global Nutrition Cluster and SUN are really here to listen to how you think you want to progress with the nexus in your country, in your context. And then we may not have the answer, but I think that the advantage of having the breadth of knowledge and experience as is contained in the SUN movement and in the GNC partners, that we will find someone that will be able to provide assistance or ideas or just someone to bounce ideas off to see how you can make the most out of the nexus in your respective countries. So that's it from me. I don't know if there are any questions that have come up in the meantime. If not, that's not that bad. As I said, this is a ongoing process, and we are there open for you, and please do not hesitate to come to us with any questions, and we will be coming to you as well with other work, other initiatives that we have thought up at global level. I remember, again, when I was, as Anna said, when I was in country, the whole talk of the nexus did seem quite remote, and we will try and help bring it in a very pragmatic and practical level to the countries, and to see what sort of blockages that you feel you're facing and what sort of incentives could be put in place to make this run smoother. Thank you.
Now, maybe just an additional piece of information. So a webinar will be held tomorrow in French, in case you want to share the information with your colleagues, which could be French speaker. So it will be at 3 p.m. Geneva time. They might have already received an invitation. And then another session also will be conducted tomorrow morning at 10 a.m. Geneva time for the country would need the kind of which are earlier riser or later riser in this case. So again, if you want to share the information. So as I was saying, this webinar was recorded, and the recording will be available on the GNC website, as well as the policy brief. So you will be able to have a look at it more in details and see also what applied to your country. Maybe indeed it could give you some ideas of activities that could be implemented in your own country. I would like to thank very much EE for making the time to be with us today and to share our experience, and in general for all the support that she provided to the case study in this very particular and difficult time this year. Thank you very much, EE.
Thank you, Catherine. Thank you, Stephen.
Catherine, before you finish, I realize that not so many people have written their names in the chat box. So please, colleagues, please write your name and position, because we use this information for reporting purposes. Thanks.
Yeah, so before you leave, please leave your name. Thank you so much for participating to this webinar. I hope that it kind of give you a few more ideas on what the nexus could be. As Steve was saying, it's a kind of a long process, but it could bring very important gains in terms of nutrition. And I know that, as I was saying, a lot of countries have already started this, and there is a lot of opportunities in many countries. So thank you very much.
Yes, thank you, AA, and thank you everybody for participating. I guess we'll let it run a bit longer to give people time to type in their name and email and position and I think agency as well. That would be very useful. And thank you very much for your participation, and good luck with the current situation and hopefully the nexus. Thank you. Goodbye.